Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about corns. Definition: a corn is a localized thickening of the epidermis secondary to chronic pressure or friction. It occurs most often on the feet. Synonyms are clavus and hiloma. Incidence: corns are extremely common. Many patients treat themselves or see a podiatrist rather than a physician. History: the patient seeks medical care because of painful feet when standing or walking. A history of ill-fitting footwear or foot injury may be obtained. Physical examination: corns are white, gray, or yellow-brown, well-circumscribed horny papules or nodules. Paring the surface with a scalpel reveals a translucent core with the preservation of skin lines. Hot corns occur on the sole and external surface of the toes, where drying occurs. Soft corns occur between the toes, where sweating results in maceration. Corn: thick yellowish plaque with intact skin lines and compressed keratin center. In epidermis, we have a thickening and a hyperkeratosis. Differential diagnosis: plantar warts and corns are commonly confused. The simple maneuver of paring the surface and identifying the presence of skin lines with a translucent core confirms that the lesion is a corn. Laboratory and biopsy: a biopsy is usually unnecessary. Corns have a clear center and intact skin lines. Therapy: the goal of treating corn is to provide immediate relief of pain and then to reduce the friction and pressure that have caused the corn. Immediate relief is provided by paring down the hyperkeratotic surface. Softening of hard corns may be accomplished with keratolytic agents such as 40% salicylic acid plasters. Changing ill-fitting footwear and shielding the sides with pads, rings, and orthotic devices reduces mechanical trauma. When these procedures fail, surgical correction of a foot deformity or removal of a bony prominences or exostosis should be considered. The conclusion of therapy for corn: initial therapy include paring down with a scalpel, softening with salicylic acid plaster, and reduction of trauma, change of shoes, protective pads and ring, etc. Alternative include surgery or correction of bony deformity. Cause and complications: persistence of the corn can be expected unless the underlying mechanical problem is reduced or removed. Underlying bursitis from chronic inflammation and sinus formation with infection, osteomyelitis, and gangrene may occur and are particularly worrisome in patients with arteriosclerosis, diabetes mellitus, or peripheral neurologic disorder. A corn will persist unless friction and pressure are relieved. Pathogenesis: repeated pressure and trauma resulting extrinsically from ill-fitting shoes and intrinsically from an exostosis or other anatomic skeletal defects result in the formation of corns. Clinical case: a 45-year-old man presents with a painful, small, thickened area of skin on the sole of his foot, just out the head of the fifth metatarsal. He says the lesion has developed gradually over several months and hurts when walking or wearing tight shoes. On examination, there is a well-circumscribed hyperkeratotic lesion with a central translucent core. There is no bleeding when the surface is pared, and no black dots are seen. The surrounding skin appears normal. Which of the following is the most likely diagnosis? A. plantar wart or verruca plantaris. B. callus. C. corn or clavus. D. molluscum contagiosum. And E. keratoacanthoma. According to our explanations, the correct answer is corn or clavus. Explanation: corn or clavus is a localized thickening of the stratum corneum caused by repeated friction or pressure, often from tight footwear. Typically found are bony prominences like toes and metatarsal heads. Has a central hard core or keratin plaque that presses into the dermis and causing pain on direct pressure. Differential diagnosis. Callus. Callus is diffuse thickening without a central core and are usually less painful. Plantar warts caused by HPV and pain on lateral compression is present and shows black dots or thrombosed capillaries. Molluscum contagiosum are umbilicated papules caused by pox virus, and keratoacanthoma is rapidly growing dome-shaped nodule with a central keratin plaque often on sun-exposed skin. Okay, this was a short explanation about corn. Thank you for your attention.